re-watch it or like want to get some more details or don't have the chance to attend today, can see the full video on the members area on the website. So you need to be a registered member of the Alliance to have access to that. And you are very welcome to use the chat. Some have already found that out, so that's amazing. If you have any questions, so post them there. We will collect the questions and we will answer, not we, but our speaker will answer the questions at the end. So we have a Q&A for that. But you can also raise your hand if you want to. You will find that function like above, and then you can raise your hand and we will give you the chance also to ask in person and directly. So then you can also decide if you want to turn on your video, your camera, for example. Yeah, I think that's it so far. Now we will start with the actual event, and we have as the main speaker here Dr. William Crosmary, who's the project manager of Eastern and also Southern Africa of WWF, so the Worldwide Fund for Nature in Germany. And he has around 2 decades of working experience in protected areas, but also species conservation, human-wildlife conflict, etc. So a lot more topics as well. William will tell us what to learn from a bushmeat consumption and trade survey in the Democratic Republic of Congo. So they have an ongoing project, a funded project from the International Alliance in the Salonga National Park. You will get some insights, including the project's background, in general, the fundamental questions they seek to tackle, the project design, but then also some challenges and lessons learned, so we can all learn from that. He will get some support from colleagues. They will be introduced later. They are present here as well. And they will then later on also can ask or answer some specific questions that may arise or give some more detailed informations. Yeah, so I think without further ado, I will give the, hand over or give the floor to William. I hope you can share it. Yeah, amazing. That works.
Yeah. Hello, everyone. Oh, well, thanks a lot, Masha, for the introduction, and thanks to the International Alliance for this fantastic opportunity to share with you some experiences from our project in DRC, in the Democratic Republic of Congo, on the zoonosis risk along the bushmeat value chains. So as Masha told you, the purpose of the presentation today is essentially to give you some context of our project, its objectives, the approach that we use, the challenges and lessons learned. Because the project is still ongoing, we won't be able to share final results with you today, but hopefully you will get some hints and pictures of some preliminary findings. The Democratic Republic of Congo, DRC, contains the largest area of the Congo Basin forest, and this forest is of prime importance for the fight against climate change, but also for the many communities who live in the forest, in the surroundings, and strongly depend on the forest for their well-being, their subsistence, their livelihood, including for bushmeat. There is about 1 million metric tons of bushmeat that is consumed each year in the Congo Basin forests, and probably that DRC represents a large share of that. And this consumption is increasing with the growing population of the country, particularly in the large cities like Kinshasa, but also in the many, many emerging towns that you can find in DRC. So this growing demand then leads to overhunting, which in turn causes biodiversity loss, which has also cascading effects on the forest, altering its functioning, its resilience, and eventually the vital services that the forests provide to the communities. But that's also a concern for human health, because the Congo Basin is considered as a hotspot for zoonosis. There's a number of historic spillover events that have been linked to wild animals consumption in the region. The Ebola virus, the monkeypox virus, just to name a few. And actually, during the current year only, the Congolese Authority of Health have reported more than 10,000 cases of monkeypox in the country and more than 500 cases of death. So that's within this context that we've implemented our project in DRC with the main objective to identify and map the risks linked to zoonotic disease transmission in the bushmeat trade along the value chains in DRC. And more precisely, we wanted to characterize and assess the scale of the bushmeat consumption and trade between a source, the source being in our project Salonga National Park, you can see on the map here, and the end markets, the large cities of the country. And we also wanted to detect and measure the presence of pathogens in bushmeat samples along the value chains. So I'm the one giving this presentation today, but I am not alone in the project. I just want to take some time to quickly introduce you my colleagues. For the WWDRC team, we had Papi. Papi was the lead of the project in DRC. Our PA, Project Area Coordinator, Mena, and Arsene, our M&E and GIS Manager. And we partner with labs in Kinshasa. So this is the National Institute for Biomedical Research in DRC with Christelle, and and the Helmholtz Institute for One Health in Germany with Yasmin and Ariane. And for the field work, we partner with local civil society organizations such as APACOL, nearby Salonga National Park. And you will see as director, Héritier. And I hope that you will have chance to exchange with all of them during the Q&A session. So the key area of our project was Salonga landscape. You've got some facts about the landscape here. This is a huge landscape which covers more than 100,000 square kilometers. It contains the largest forest national park in Africa, the Salonga National Park, which is about 35,000 square kilometers, the two light green block that you can see on the map. This is one of the last remaining intact forests in the tropics across the world. Outside of the park, you have community lands that cover much of the landscape, communal forests, logging concessions, villages. And the principal threats on the landscape's biodiversity is overhunting. The landscape is a key source of bushmeat, not only for the communities around the landscape, but also for the populations of the large urban centers like Kinshasa. The park is co-managed by the Congolese Institute for Nature Conservation, ICCN, and WWF, with the main objectives to reduce poaching and illegal trade, to develop tourism, to build the necessary infrastructures in and outside the park, but mostly to work with the local communities in the surroundings to improve their livelihoods, their well-being, but also to identify and develop with them alternatives to bushmeat and different alternative livelihoods, like for instance, creating community forests, improving agriculture practices to increase and diversify food production, so mainly rice, manioc, peanut, palm oil, rubber, and also by increasing the amount of marketable goods that can involve the private sector. If you want to know more about Salonga National Park and what we do in the park and the surroundings, you can have a look at this webpage here. Salonga is a pristine tropical forest. Almost 95% of the landscape is covered by forests, being dryland forests, floodplain forests with a mosaic of rivers, streams, marshlands, grassy clearings, swamps. You have some pictures here, but I cannot resist showing you a short video of the forest to get you a sense of what it looks like. So I'm going to share my screen. Let me know if you can see the video. And so this pristine forest is home to an incredible rich biodiversity that includes, many endemic species, but also many threatened species. Among the most emblematic species you can find in Salonga, you've got the forest elephant, you've got the bonobo. Actually, 40% of the world's bonobo population live in Salonga. You have many bird species, some being endemic, like the Congo peacock. You have several antelope species. You have many monkey species, more than 500 flora species, lots of reptiles and insects. And many actually new species for science are being discovered currently in the park. Salonga is also a semi-landlocked landscape, very, very remote and difficult to access. In and around the park, there's a very low density of communication networks. You've got few roads, so you can see, for example, in this map, the red lines, but most of these are in very poor condition, and that's a major obstacle to economic development in the landscape, which limits trade and restricts a lot, people's access to basic services. So how do people get in and out of the landscape? There's an extensive network of rivers and tributaries. So a very obvious and key mean of transport is boat, mostly canoes, which provide access deep into the park. You can also use motorboats, large ones, but essentially on the larger rivers. And of course, well, another way of traveling across the landscape is on foot, bicycle, motorbikes, but with the key challenge to have to cross multiple rivers on the way on bridges that are not really often reliable. And things get even more complicated during the rainy season when the whole place is almost flooded. So traveling across the landscape is long, tiring, and quite risky. Salonga is also a landscape of communities. You've got about 100,000 people who live there from different ethnic groups, including indigenous people. The density of human population on the periphery of the park is quite low. At most, you've got maybe 3 to 4 inhabitants per square kilometers. But in the main urban centers and towns in the immediate periphery of the landscape, the human population size can reach several tens of thousands of people. And most of these people live with less or about $2 per day. And so they really closely remain on the forest. They're really dependent on the forest. 75% of the households are involved in agriculture, whether it's for self-consumption or sale. They essentially grow and consume cereals, tubers, maize, cassava, rice, sorghum. They grow also vegetables, leaves. They consume fruits. And in addition to subsistence farming, there's some kind of cash crop farming on oil palms and rubber especially. Livestock farming is not very well developed in the landscape. Some households farm goats, sheep, poultry, pigs. Cattle farming is almost not developed. And livestock is actually essentially used to cover exceptional expenses, gifts, or to solve village conflicts. And because you don't have, vet services in the landscape, the communities experience episodes of epidemics on farms that sometimes decimate their entire herds. People also rely on non-timber forest products for medicinal purposes, crafts, building material, as a source of food, but also income. In terms of infrastructure, the landscape is really not well developed. Most households have no access to running water, no access to electricity. The health centers are very few and poorly equipped. And you've got about 70% of the households that actually have given up on medical care simply because medical care is too far away from them, it's too slow, it's too expensive. And then because of the poor condition of the road network, the limited access of the landscape, the access to markets for farm products is very challenging for the communities and does not sufficiently pay off. So people tend to turn to hunting for financial gain. And so with that, hunting is a vital livelihood activity in the landscape. As I said a bit earlier, Salonga is a major source of bushmeat. You've got tons of bushmeat that enter the markets each week in the main towns around the park. And this bushmeat remains the most affordable source of meat for the communities. The domestic meat, pork, chicken, has only limited availability in the local shops and markets. This is probably mostly due to the fact that there's a lack of electricity, and so there's no way to properly conserve the meat. And when the domestic meat is available, this is extremely expensive for the communities. So most households in Salonga, for most of them, hunting for bushmeat occurs primarily to satisfy their dietary needs for the family. And if there's some excess of bushmeat, then this excess of bushmeat is traded, and the income is used to purchase other food items, to invest into medical care, to pay school fees, and so on. Now, in the main cities of the country, such as Kinshasa, where you can find alternatives to bushmeat, the drivers for bushmeat consumption may differ. People there may consume bushmeat either as a delicacy or for taste or for cultural beliefs. And because you have a growing demand for bushmeat overall in DRC, you've got some hunters who start to specialize in commercial hunting. And the big issue is that hunting is not very well regulated and enforced in DRC. And so it's essentially carried out outside the norms of legality, sustainability, and good governance. And that translates into the loss of wildlife in the landscape and hunters having to go deeper and deeper into the forest to find their prey. Among the prey species that hunters select or target in the forest, you can find some taxonomic groups like primates, bats, pangolins, rodents, which are known to be high-risk reservoirs for the most virulent pathogens. In these slides here, you have an illustration of the general structure of the bushmeat trade chain in DRC. So the bushmeat is transported from the park to villages, to mid-sized towns, and then to the large city like Kinshasa via various modes of transport. And again, because of the poor transport network in the landscape, and because of the long distances also, it can take weeks before the bushmeat eventually reaches its final destination. So it takes a while. The hunters are essentially men. They usually set up camps in the forest where they spend a couple of days or weeks, hunt the wildlife using different equipment, fishing nets, spears, snares, guns sometimes. And they smoke on site large amounts of meat to preserve the meat before transport. They then travel the meat to the villages or the markets, inside or outside the landscape, where they can sell the meat directly to consumers or to retailers. And these retailers are essentially women who travel to the villages maybe the day before the market day and wait for the hunters to come back, to return from the forest. And then they travel to the markets, sell the meat to the vendors or directly to consumers in the markets. And these vendors in the markets that you can find are either men or women. And in addition to bushmeat, they often sell other products like fish or non-timber forest products. So a few words about the methods that we use to try to map the zoonotic risks linked to bushmeat consumption and trade in DRC. We first used existing information and data from anti-poaching patrol data, biomonitoring reports, bushmeat reports, expert and local knowledge, first to select the study area, places where we wanted to implement our project. And this work helped us to identify the southern part of Salonga, which appeared to be the major place for bushmeat consumption and trade in the landscape. From two studies conducted by WWF in 2007 and 2012, it's been estimated that a minimum of 10 metric tons of bushmeat was sold or was transiting through these areas on a daily basis. So we sent two field teams there, one here, and then a third field team in the large urban centers of the country, mainly Kinshasa and Kikwit. And the pink arrows you can see on this map here illustrate the main routes along which the bushmeat is being transported from the park to the different cities in the country. And on this map here, you can see the points. So the small green and yellow points are actually the markets and the villages that we've planned to visit at the beginning of the survey. And here you can see some of the distances that the teams had to travel across the landscape while implementing the project. The first method we used was market survey. And for that, we actually used a tool developed by WWF colleagues in Asia to assess the zoonotic risk in each surveyed marketplace. This overall zoonotic risk is identified by a combination of two different risks. The first one is what they call the market risk, which depend on the size of the market, on the presence of stressful conditions for animals, on the presence of unhygienic conditions, non-biosafe behaviors, on the number and turnover of people in the market, on the distance consumer may travel eventually after having visited the market. And you have a gradient of risk from a very low risk, for instance, in the small points of sale in the villages, to a very high risk in the large urban markets where you can find bushmeat. Then you have what they call the risk linked to traded taxa. And this risk depends on the species or the group of species that you find in the market that are being sold in the market. And some groups that you can see here, specifically bats, primates, rodents, are known to be more dangerous than others for human health. And so not only their presence in the market, but also their quantity define the risk linked to traded taxa. And the combination of the two risks gives you the overall zoonotic risk at each marketplace. So for instance, if you are in a large urban market and that you find this market quantities of primates and rodents, then eventually the zoonotic risk is in theory very high. So with this method, we surveyed 160 markets around Salonga and in the main cities. And during these surveys, what we did is to record the species that were being sold, of course, which formats. So were they live specimen, dead animals, were they sold as a whole carcass, as fresh or smoked meat. We also recorded the environment of the market, of the point of sale, the size, the hygiene conditions, the behaviors of the vendors, for example, whether they were washing their hands, whether they were cleaning the surface on which they were cutting the meat. We recorded presence or absence of running water, presence of domestic animals, whether the vendors were using, freezers or cooler boxes to store the meat, and so on. So I really invite you to consult the paper to get further information on the method. In addition to the market survey, we've run also interviews of the different categories of actors involved in the trade. So interviews of hunters, interviews of consumers, of vendors, transporters. And these questionnaires for the interviews were designed in collaboration with our partner, the local civil society organizations, to ensure cultural values were respected before interacting with the communities. We used semi-structured interviews and focus group discussions to collect a bunch of information on where the animals or the meat came from, how they were transported, at which frequency they were used, they were hunted, sold or consumed, in which format the animals or the meat was stored, handled, and sold. We recorded or we asked questions about the behaviors related to hygiene, whether they were using soaps or cleaning their knives after having cut a piece of meat. We also asked them questions about their experiences and knowledge about health issues related to bushmeat consumption. And all the actors that we interviewed, that were involved in that study, participated freely. The objectives of the study, of the questionnaires, of the interviews were beforehand introduced to the local authorities, so the chiefs of the sectors, the chiefs of the villages, of the marketplaces, in order to obtain the necessary authorizations before asking questions to the people. And we systematically aim to be gender balanced and also to assure anonymity of the responders. In addition to the market survey and to the interviews, we also sampled small pieces of tissue from the market, so muscles, blood, from the wildlife that we found in the market to assess the presence and load of pathogens, viruses, bacteria, including coronaviruses, filoviruses, and different sorts of retroviruses, and also anthrax-causing bacteria. On these samples, we've run a first set of lab analysis at the lab in Kinshasa, and then we flew a subset of samples to Germany at the Helmholtz lab for quality control. And I will leave my colleagues from INRB from the lab in Kinshasa and Helmholtz give you further details on the lab analysis if you have questions about them. For the actual fieldwork, we partnered with 2 local civil society organizations that had an extensive experience of the Salonga landscape, of interacting with the communities in the landscape, and also with staff able to speak the local languages. And for Kinshasa and Kikwit, we had a team composed by WWF staff and 3 interns. And so typically each team had 2 to 3 local field assistants supervised by a research lead. And before sending the teams to the field, we gave them a 3-day training session on data collection, bushmeat sampling techniques. And then once the teams were in the field, we asked them to test the protocols in real conditions for a week. And the protocols and the questionnaires were adjusted accordingly where needed. So because we were planning to send the teams in Salonga for a long period of time, 3 to 4 months in a row, they really needed to be self-efficient in the field. And so for that, we had to purchase a long list of equipment such as camping gear, satellite phones, power banks, batteries, and so on and so forth. We also had to buy lab equipment, lab reagents and material for the lab in Kinshasa. We also started, before the fieldwork, we asked for official permission from the government to conduct the study, and therefore we received an official research permit. The process was pretty straightforward because WWF and the lab in Kinshasa, INRB, are very well connected to the governmental institutions. So all of that was a theory. Now in practice, how did that go? The project officially started in mid-December 2021. Then, the time to develop the protocols, to select the field teams, to hire the consultants, to purchase the equipment, that slowly led us to February 2022. And February was not the best timing to start the fieldwork because this is the rainy season. So we had to push until April and the start of the dry season to deploy the teams to the field. And then, given the context of the Salonga landscape, the scale, the limited access, the field conditions were very difficult and challenging for the teams. We've seen that in terms of transport. I mean, there's been a lot of walking around, motorbiking, cruising on canoes, sometimes with the motorbikes on the canoes. There's been many nights in tents, lots of equipment to carry, camping gear, computers, smart devices, stationery, sampling equipment, food. So lots of fatigue, many risks, breakdowns, accidents, being sick of malaria and so on. So the field work was really not a piece of cake, and I'm pretty sure that the field teams can testify about that afterwards. A major issue for us, the coordination team, was to maintain a technical support and monitoring of the field teams once they were in the field. The project lead in DRC, Papi, had 3 teams to coordinate at distant locations. He was based in Kinshasa, which was really convenient to provide continuous support and guidance to the team in Kinshasa and Kikwit, which was a less experienced team, but also that was convenient to be in contact with me, who is based in Germany, in Europe. Papi flew at a couple of occasions, 3 times to the landscape to meet the teams and get some updates from them and provide some support. We couldn't really fly him more often because the flights are really expensive, and also there are very few airstrips, maybe 1 or 2, that could get him close to the team. So for each meeting with Papi, the teams were required to leave their activities and reach Papi, sometimes at very long distances at the meeting point. So that was not really convenient. There were lots of effort, time, and money. So we eventually largely rely on phone calls, WhatsApp messages, Zoom calls to try to keep a regular communication with the teams. But because of the network in Salonga, which is not really reliable, that was very difficult. And plus the smartphones that the teams use were also used to collect the data on the market surveys. And these smartphones tended to quickly run out of charge, and the power banks were not sufficient. And so the team had to find places where they could rent generators to recharge their phones. And once the phones were recharged, then the teams try the maximum to use them, at the very minimum levels just to save the batteries. The satellite phone was not really an option to communicate regularly because the communications were too expensive. It's about $1 per minute. And so, well, obviously the teams just save the satellite phone for emergency calls only. So all of that to explain that really limited the frequencies of updates we could get from the teams when they were in the field. And so one major consequence of that is that, overall the oversight was a bit loose. And so we were not able to check the quality of the data collection and data entry in a timely manner. So probably one thing that we could have done better would have been to allocate more time to the training of the field teams and also more time to the testing phase, just to make sure that the teams, reached top-notch capacities in data collection and entry capacity before sending them out in the field for 3 months with a minimum supervision. Another challenge was the fact that the meat or bushmeat consumption and trade is quite a sensitive topic to investigate on. And so there's a fear of law enforcement in the communities. And so there might be a lack of trust when you approach them to ask questions about bushmeat consumption, especially as you get closer to the national park. There was also a certain fatigue with the communities. This is not the first study on bushmeat in the landscape. And so the communities at many occasions complained to the teams that they used to receive no concrete help from the previous studies on bushmeat. And they also said that they anyway didn't really believe that wildlife could represent a risk for health. But despite of that, several things really helped the teams to get overall a good collaboration from the communities. The fact that the field teams were from civil society organizations that I lose you? I'm still on?
Yes, yeah,
Oh,
you're still
sorry.
here. I can still hear
Yes,
you.
you are.
I thought I was disconnected. Yeah, thank you.
No, all good.
Yeah, I was saying the fact that the teams were coming from civil society organizations known by and trusted by the communities helped. The research permit also helped. We also the field team spent time in pre-meetings with the local authorities, the chiefs of villages, chiefs of the markets, just to explain to them in detail the project. And also the fact that the questionnaires were anonymous and that the interviewees could stop at any time the interview. The questionnaires were probably too long. We had actually more than 40 questions per questionnaire. And we realized afterwards that, not all of the questions were well understood by the communities, maybe because of an inexact translation into the local language, maybe because the question itself was not clear enough, or because it was not well asked. So again, here, if we had to redo the project, we would definitely run a longer testing phase to get more feedbacks from the communities and to fine-tune the questionnaires before asking the questions to the communities. Another recurrent problem that we observed when we got the data back from the field teams was especially about the questions on the locations. So for example, when we ask questions, what's the source of your wildlife? Where do you get your wildlife from? Many locations in the database were misspelled, or different locations had similar names. And another issue also was that some of the locations referred to different geographical units, so either a village or a sector or a province. And so eventually it turned out to be for us very difficult afterwards to put these locations on a map. So here, more work on maps with the communities while interviewing them would have been very helpful. while we conducted the surveys in the markets, another challenge was to identify the species at sale. For some of the species, I mean, the identification was pretty straightforward, especially when you had the whole carcass of the animal, for example, for those ones here. But for other species, the teams found it difficult, especially when you had pieces of meat, fresh or smoked meat. And so for these species, the teams really had to rely on the names given by the vendors in the markets, which was also a source of mistakes at some occasions, you know, because the same species can have many different names in the local languages. And some of these names were unknown by the teams, which led to misspelling in the database again. And then you've got the vendors in the larger cities, especially, who tend to have less knowledge of the distant forest species. So they can often tell you, you know, the generic group, but not the species itself. You know, it can tell you this is a duiker that I'm selling here, but I can't tell you which species of duiker it is specifically. So for the species for which we had some level of uncertainty, then we asked the team to just record in the database the generic groups. So something that would have been useful here is to use maybe pictures from available literature, or maybe an app on a smartphone with the pictures of the wildlife, just to confirm with the vendors, the species they sold where we were interviewing them. And maybe also to take pictures of the products and get eventually, experts to confirm the species identity afterwards. Some post-DNA analysis could have been useful too, and we are actually planning to run some of them for few samples to do species identification. But this comes, obviously with additional expenses. And this is probably not something that you can do systematically for every single sample, but at least for the samples for which you have some doubt on the species. A thing that we probably underestimated was the time required eventually to clean the data and enter them on the computer. For the market survey, we had developed an entry mask on smartphone. And so it was eventually very easy and straightforward to download the data on computers. For the interviews, though, we had no entry mask, and so we recorded the answers on datasheets, and we collected more than 1,500 datasheets. And each of them had 7 pages with 40 questions, and require, eventually more than 1 hour per person to enter the data from the datasheet to the computer. And as I said before, because we couldn't get, regular updates from the teams, there was a significant delay between data collection, data checking, and data entry. And so many mistakes or omissions in the data could only be identified after the field period. So I can tell you that the data cleaning has been and still is actually a long and painful process. On the samples, we collected about 800 samples. The first issue was to convince the vendors in the markets to let us, take some bits of their meat. Most accepted, some didn't want to, some didn't even understand why we wanted to collect, pieces of meat. And then for the teams in Salonga, these samples, once collected, could not be sent right away to the lab in Kinshasa before the analysis. So they had to keep the samples a couple of weeks. We were able to arrange a flight from and to Kinshasa every 21 days or so. And that's about the maximum period of time you can keep the samples at ambient temperature, in RNA later solution before they start to deteriorate. Another issue is that we were not able to get samples from bats, despite the fact that the interviews revealed that the communities, consume regularly bats. But we simply didn't find bats in the markets. So it seems that people don't buy or purchase bats in the market, but rather they hunt bats themselves. So you've got here a table that illustrates, the samples that we've been able to collect and to work on. You've got here Christelle doing some lab work in Kinshasa. Finding the lab regions, the DNA extraction and PCR kits in Kinshasa turned out to be very challenging and costly. And so eventually we had to do the whole procurement in Germany with Helmholtz and have one of their experts, Yasmin, to travel to DRC with the lab equipment, which, delayed the lab work in Kinshasa for a couple of weeks. And then some of the PCR extractions tests and all of the high-speed sequencing could not be run in Kinshasa, and so we had to do that in Helmholtz in Germany, which meant that we had to send the samples from DRC to Germany. And to export the samples from DRC, we had to get a special permit issued by the focal point of the Nagoya Protocol in DRC. And this permit was actually a precondition then to obtain the import permit from Germany. So that was a long process again, and particularly for the samples coming from CITES-listed species. Most of the samples we got came from smoked meat, which may or may not, I will leave my colleagues from the INRB and Helmholtz discuss about that, but which may have limited our capacity to detect pathogens. For now, our lab analysis were only able to detect zoonotic pathogens from fresh samples. So if we go for a next phase of the project, something that we would really like to do is to go with the hunters in the forest during the hunts and really take samples from fresh samples from the very start of the value chain. So yeah, because we're still running the analysis, I can't show you final results here, but I can give you some hints. Almost all of the markets and point of sale that we surveyed sold bushmeat. And we found a lot of specimens coming from species with a very high risk potential for health. Primates, rodents, mongoose, civets. Despite the fact that most of the meat we found was smoked, we were still able to find in the markets, including in town, fresh meat or whole carcasses of animals being butchered in the markets. Handling, butchering, trading the meat was largely done under unhygienic conditions with bare hands, as you can see here on the picture, in direct contact with the blood. And many vendors actually admitted that they got frequent cuts from while butchering the meat, that they didn't use soap, that they didn't use clean, or they didn't clean the surface on which they were cutting the meat. You could see also in the markets that wildlife is really often mixed with other food items, domestic meat or fish or vegetables. And something interesting too in interviews, most of the people we interview say that they've heard about disease like Ebola, but a very portion or small fraction of them actually believe that wildlife could cause disease to humans. Something quite interesting too is that the actors of the bushmeat trade seem to have very well defined role along the chain. So men are essentially involved in hunting, and women are really involved in the sales. And so that means that exposure to the risk may differ across these different actors. And that's probably something that we need or will need to take into account when will come the time to devise, awareness and training campaigns to these different target populations. Yes, and this is the end of my presentation. So really happy to answer questions, try to answer questions and to get some of the comments and feedbacks. Thanks.
Yeah, thank you very, very much for this really amazing presentation and all the given information. I believe strongly that now everyone has a very good impression of how the project works and also how the work on the ground looks like. Someone already asked about sharing your slides maybe afterwards. So I think that is that possible for you to share your email so that they can get in touch with you, or would you prefer us uploading your slides also on the website?
Yeah, you can upload the slides in the website, no problem.
Okay, great.
With pleasure.
Good.
And I can enter my email in the chat box.
Oh, perfect. I think Annie has a bit more an idea what questions are found in the chat, so I'll hand over.
Yes, thank you. Thank you again, William. It was a very, very good presentation, very insightful. Thank you so much. We have one question already in the chat, but please feel free to also just raise your hand and then you can get in direct discussion also with William and with the team. So there's a great opportunity, I think, to also talk to some of the people that were involved on the ground and in the implementation of everything that William just presented on. So it's a very nice opportunity. But we can start with Natalie, who's asking if there are any national legislations related to zoonotic disease prevention that regulate the trade and consumption of bushmeat. I don't know, William, if you have any more insights on the more political context in DRC on that.
Yeah, I would like to maybe leave my colleague Christelle answer that question. She's from DRC working for the national lab, so I don't know whether she's in the call. Yasmin, do you see whether Christelle is in?
She was mentioning connectivity issues before, so I'm afraid she might not be in this call.
And will you be able to answer that question, Yasmin?
I'm afraid I don't know any further details about that.
Yeah, so I can tell you that, you know, for hunting, for example, and consumption trade, there's a legislation in DRC which has not been enforced for years now. So hunting in the Salonga National Park, although, you know, there's a regulation, it's almost open access for everyone. Now, considering health monitoring and the zoonotic risk, you have DNRB lab in Kinshasa, who is responsible for running, you know, the analysis when it comes some suspicious about some kind of samples from wildlife. Yeah, that's what I can tell you. So I guess I will have to follow up with Christelle when she will be joining or later on to give you more insights about that.
Okay, thank you. I think we have Ian Redmond raising his hand. If you feel free to unmute yourself and just ask your question.
Thank you very much. First of all, echo the congratulations that are appearing in the chat box for an amazing piece of work. That's to all the team, but a very good presentation. Just on that last point about law enforcement, there is a very dynamic law enforcement NGO called Conserve Congo, helping authorities bring prosecutions which often involve confiscation of products. Have you worked with them? Because that's another, perhaps a random source of samples, but both live animals and butchered animals that you could use to sample from.
Yeah, thank you for the question, Jan. We're actually teamed up with APACOL, which is another local civil society organization in the landscape, which, you know, does this kind of work, working on seizures, confiscations. We do also work with ICCN, the National Authority for the Park Management in Salonga, and other stakeholders. So we do have access to this kind of samples from seizures, but I have to say that we've not used that for the survey. We really wanted to check in the markets, you know, whether we could find some pathogens. So, but that's an idea. We can definitely, you know, reach out to the local authorities and these civil society organizations to get some samples and increase our sample size.
I'd be happy to
Thank you.
introduce you to Adams
Yes,
Kissinger.
thanks a lot. Yeah.
Okay, perfect. Yeah, we can definitely follow up on that. We have another Dr. Kizito. Do you want to unmute yourself and also ask your question, maybe directly?
Yeah, thank you so much for your presentation. I'm Dr. Kizito from DRC. I'm a vet, and I was working before with the ICCN, but I'm still working in wildlife. So I want to react about zoonotic reglementation in DRC, the question. I think up to now, there is no reglementation because I was working in disease survey, epidemic surveillance program in Kahuzi-Biega National Park. And we developed just one strategy, which should be shared in the ICC in different parks. But as you know, we have a challenge in DRC. We don't have vets in different parks. So One Health approach was neglected in DRC. And it was just several partners was focused only on human health. And they didn't take into consideration wildlife health also, or animal health. But now I think on national level, now the government is working. They did a program which can be a direction, which is like a One Health direction. And in different provinces, they are now implementing those professional coordination of One Health approach, which can take in charge of human health, animal, and environmental. But there is no official reglementation about zoonotic disease or One Health approach. Now, maybe it will be in a few days. But I had an honest question about the samples. When he was exporting samples, do you think you did get problem about CITES permit for some samples which was being collected from CITES listed species? Because I know sometimes you got only the permit from Ministry of Environment, and I know on about international trade or international in CITES you have to get some permit or at least some certificate about the origin of some samples. You didn't get any problem about that? Thank you.
Yeah, thanks, Doctor, for the clarification of the legislation and that question. I'm going to leave my colleagues Hari and Yasmin, because they were the ones, having to face the burden of transporting the samples, so they know all about that. So I don't know, Yasmin or Hari, yeah. Hari? No? You're mute.
Yeah, we cannot hear you.
Yasmin, maybe.
Yeah, I can say we experienced those issues as well. That's why we've not been able to export all the samples that we would have liked to export.
We had a couple of samples, especially coming from Annex 1, like bonobo, and it turned out to be very difficult. I mean, that's a very long process, of course, and we failed to move all the samples back to Germany.
Okay, good. Thank you so much.
Okay, thank you. We have more questions in the chat from Daniel. I don't know if you want to maybe speak up as well, or otherwise I can also just read them out to you. Well, the first one was if bushmeat hunting is regulated in DRC. I'm not sure if maybe we've also talked about this. If yes, what could be the requirements for locals to hunt? And then also as another follow-up question, have you thought of engaging vets and public health officer on your work in order to start forging the One Health basics to solve some of the issues that you have found on the study?
Yeah. So bushmeat hunting is officially regulated, especially when it comes to go into national parks or protected area. So there are laws, but the problem is, how to enforce the laws. And then in the communal lands, there's some regulations too, but there's a lack of good governance. So it's difficult to restrict access to the lands to, even hunters coming from outside. And then we did have vets in the project. I mean, Christelle is a vet, Hari is a vet, so we had vets, and yeah, that's the idea, trying to, align with this new initiative that Dr. From DRC mentioned a bit earlier, moving to One Health in DRC, having the vet will be helping us to try to develop in the landscape an early warning system. So one issue is that we probably tend to be too late to detect, presence of pathogens in meat, simply because we have no vets on site and no lab running. So probably that, increasing the surveillance around the landscape and all along the value chain would be something tremendously important to detect the risk and then to act on that. And so the vets will be major actors in that sense.
Okay, perfect. Thank you. I hope that answered the question. Then we have another question on the chat before I will also call on Rosette. From Ilka, I don't know if you would like to speak up, but otherwise I can also read it again. Have interviewed people requested to get informed about the results of the study or the samples? And if so, what is foreseen?
I didn't get that, sorry. Come again?
If the interviewed people have requested to get informed about the results of the studies and the samples, and if they have requested that, how is the communication between you and your interviewees?
Yeah, so they've not systematically requested that. Some of them did, and so we will have a follow-up discussion with them. What was really important from the discussions we had with them was the fact that they really, there's some kind of, as I said, fatigue, discouragement. I mean, that's not the first survey, and so what will really make difference with this one is that we build on the results to devise with them some campaigns, whether it's demand reduction or behavioral change or awareness. So that will be a follow-up, and this is something we want to do. And we've been discussing because we are present in the landscape, and we've been present for decades now. So this is really something that we've got in our minds to follow up on the results and go back to the communities and try to discuss with them, discussing about the risks, explaining them where the risks linked to what behaviors, what species, and then agreeing with them with, doing some trainings or awareness campaigns.
Okay, thank you. Rosette, do you maybe want to unmute yourself and ask your question?
Yeah. Yeah. Hello, I'm Rosette. I'm working for the University of Lubumbashi. I want to thank Dr. Williams for this nice presentation because it gives us more idea on what we are working on. I wanted to share with him that I did some kind of investigation of on bushmeat, trying especially to identify enteropathogenic bacteria using PCR. And we faced also many problems because we don't have the equipment, and we had to move all the samples in Belgium at the University of Liège. And we did our PCR based on directly on the enrichment media. And with that techniques, we could identify in smoked game meat some enteropathogenic bacteria as Salmonella, Campylobacter, and Escherichia coli. So I wanted to share with him this part of our study. And we are trying to do at large scale another study with my colleague Didier Chikung, who's actually working in protection of wildlife in Katanga. So that was my contribution to his presentation.
Thanks a lot, Rosette. It's good to know, and yeah, we should probably follow up on that together. You can contact me via email and we can discuss about potential synergies.
Okay, thank you.
Yes, thank you so much. Yeah, we have another question from the chat by Mattia. I don't know if you also want to speak up, but it was a question about if you could provide some about how you selected the respondents to the questionnaires, if there were any criteria that you had on how you chose who you would like to have respond to the questionnaires.
Yeah, that's a good question. So that was essentially randomly. Well, it's not exactly true. Actually, what we did is that we selected the places, marketplaces where we wanted to start the survey because we had some prior information that we could get from, again, the existing information. So we started from there, and then we simply randomly do a snowball, random sampling. So making sure also, well, we try, as I said, to have the same proportion of women and men also in the interviewees, but that may question maybe the representativity of our sample.
Okay, thanks. I will just keep on reading the questions in the chat, but also I just encourage you to just raise your hand and come forward anyways. But we have another question by Ian Redmond again. Did you see any impact of the controversial ministerial directive allowing hunting on payment of a fee? Is this something that it's a ministerial directive? I don't know, Ian, if you would like to maybe explain the background or the context of this?
Sure. A couple of years ago, a minister drew a lot of criticism from conservationists for producing the directive. I put the number in there, and I can share a PDF if people want it, which had lists of all species, protected and unprotected, with a price tag for what you would have to pay if you wanted to hunt it. And it's under scrutiny at the moment, so it's been challenged by civil society. But I just wondered if the news of, oh, okay, if you pay a fee, you can do this. We can't afford a fee. Was it talked about? Did anyone say, oh, now we know it could be legal if we just paid, whether or not we're, not enforced at all, but
yeah, I've heard about that. I have to say I've not followed up very on that, so I don't know whether we do have colleagues from DRC who can comment on this, or whether they have some further information. Sorry, I don't.
Okay.
Otherwise, maybe we can also just we will in the end we will post our email in the chat as well, and then if there's any questions that you still have that remain that you
Please
want to
do
follow
so.
up, yeah, you can either send an email directly to William. I think he already shared his email, but otherwise you can also always contact us, and we will forward it as well. So if there's anything remaining, please send us an email. Okay, but thank you for the question. We will continue with Jonathan Colby. Have any of the samples yet tested positive for zoonotic pathogens, and how did you decide which pathogens to test for?
I'm going to leave my lab colleagues, experts, answer that.
Yeah, so we are still running analysis of sequence data. That's where I cannot specify what exactly has been found, but there were samples indicative of both viral and bacterial pathogens that are that have a zoonotic risk. We tested for a broad range of pathogens that can have a high impact on human health. So we tested for the family of orthopox viruses, which also contains monkeypox, which has been causing outbreaks in the region. We tested for filoviruses, which is the family of Ebola viruses. We tested for coronaviruses, which we all by now know can have a high risk on human health. And also retroviruses. So we tested for relatives of, for example, HIV, which can also be transmitted, from primates to humans.
Cool, thank you. Okay, I will have one more question from the chat, and then we can also go to Barbara. I will continue with Van Loo. Do you have any information about the end user of the bushmeat? And if so, what are their characteristics?
About the, sorry?
The end users of the bushmeat, the ones, I guess, the consumers.
Yeah, we've actually interviewed, I think, something around 400 people in the markets who, we encounter in the markets who were coming to buy bushmeat. And so we have information about that. We're still running through the analysis, so I can't give you any final result, but you have different drivers, especially, there's a gradient of drivers from the source or the landscape nearby Salonga to Kinshasa. So as I said, in Salonga, you've got a high proportion of people who actually just need bushmeat because there's no or very few alternatives. And so the driver is I need to take or to get my protein intake, on a daily basis. And so this is the only source I can find. And then in town, you've got different drivers. You can have people who, just, for the social status, for example, just want to show off and consume bonobo, invite colleagues, to have bonobo's meat. You have delicacy, you have different cultural beliefs. So this is we've got this information. We're just, finalizing the analysis.
Okay, perfect. Thank you. Barbara, do you maybe want to unmute yourself and pose your question?
Yes, thank you very much. William, that was a great talk, and it's lovely to see this wonderful project. It's really amazing. I'm not sure that everybody knows, but we are also working in this area and currently have a project running where we try to sort of separate the traditional hunting from the commercial hunting. And my personal approach or vision is always that for the local people, I would like to conserve the opportunity for traditional hunting because it's part of their traditions of the area, and man has sort of coexisted with wildlife across millennia. So this is a bit my approach, although I know that the commercial hunting impacts highly, and we are sort of trying to level out the sustainability of what's currently going on in this very small area where we work. It's very small compared to what you covered. So I was wondering whether or not you can share your vision with what you want to do with these results. Is your goal to ban hunting of wildlife completely, or do you also have a different vision?
Thanks a lot for that, Barbara. That's a very crucial point. There's no silver bullet for that, and so you have to come up with a mix of different approaches. Banning hunting is nonsense, I believe. I don't believe in that personally. I think that, like I said, I mean, people there not only need hunting, but also that's part of the culture. So we can't prevent that. And actually, law enforcement have been trying to prevent that for decades now with no success or no impact. There's some bans on some species, but still people, keep on hunting. So I think a good approach will be you can have awareness campaign, demand reduction campaigns, behavioral change campaign. But I think the goal will be try to transform the bushmeat trade and consumption towards something which is legal, sustainable, and safe. So pretty much like what is trying to do, the SWIM, Sustainable Wildlife Management Program with C4, CIRAD, and FAO. This is really something interesting. I think it's a fantastic avenue, trying to go around the issue and not forbid or ban hunting, which is almost impossible, but make it sustainable and safe. Yeah.
Thanks.
Okay, thank you. We have another question by Manon about your follow-up. So will your follow-up intervention also include some specific livelihood activities to address the food security issues? For example, for specific villages where wild meat consumption is mainly for direct food consumption.
Yeah, so we've been doing that actually for a number of years now. So it's not something we're gonna start from scratch. We've got with ICCN, so the National Authority of Salonga National Park, we are working in the landscape, and this is what we do. We're trying to provide alternatives to local communities, doing sustainable agriculture, sustainable forestry, improving also breeding, herding. So that's a long process, of course. Not only it takes time to not only raise the capacities on breeding, domestic animals, but also you have to come up with vet services. So that's one thing to try to grow animals in your farm, but if you don't provide, vet services, then you just, create a new issue. So we're doing that, and that's a long-term process.
Okay, thank you. And I think we have one last question by Iris, who is also, I think, very happy to connect. But a very practical question regarding the lab in Kinshasa. Who is responsible for maintaining the lab? Is it the government or is it the WWF?
That's not WWF. That's the government. Yasmin, you can elaborate on that if you want. That belongs to the government, right?
Yeah, it's the National Research Lab for Biomedical Research. So also a lot of health surveillance of the DRC is being done there, actually.
Okay, thank you. We still actually have a bit of time, so I'm not sure if maybe there's some people who still might have a question. It's your last chance to put it in the chat or maybe raise your hand. Yes, Ilka, maybe unmute yourself and come directly in.
Yeah,
Yes.
Hi, William. Nice to hear about the project and its involvement now. A great presentation as well from my side. Yeah. Maybe since Barbara touched upon it already, can you already say if there's some differentiation in the people, what species they actually hunt? Or is there some awareness that maybe bonobos are an endangered species? And therefore they not go for it. So can you already, I know you're still in the analysis, but is there already something you can say about a different or differentiating picture from the hunters themselves?
Yeah, it was good to see you, Ilka. Thank you for the question. Yeah, you're right. And we get this information. We ask actually the people we interviewed, hunters, villagers, about their knowledge of local regulations on species consumption and hunt. And so they were very well, they can list the species that are actually forbidden to hunt, and bonobo is clearly one of those. Elephant is also another one. They know that because, thanks to the partners, Barbara's work, the work of ICCN, our work in the landscape for the past years, we've been trying to engage with the communities to inform them about that. So there's some knowledge. The issue is that it may be that from some local communities, they've got information, but they don't respect information, or they don't act on that simply because it's not really interesting, and there's no there's a lack of incentives to conserve wildlife. So that's the core of the work that we're trying to do in the landscape, is just, create those incentives linked to wildlife presence in their garden, so that they don't only, pay the cost of living next to the wildlife, but they get some benefits also. And so that's why sustainable hunting will be probably a promising tool.
Thank you.
Okay. Cool, sweet. Thank you for answering all the questions. I might have one very last question myself on the language barriers, because we've talked about that there's like different names for different species in different languages, and just generally on the awareness. I'm not sure if you can maybe elaborate a bit more on how big of an obstacle you would assess that the language barrier is actually when you do your work, or also with your project and getting the results and communicating the results.
Yeah, so we knew that was going to be an issue, and this is why, from the beginning, we engaged with local civil society organizations who have staff who live in the landscape, and so who are able to speak, the 4 or 5 different local languages they can find in the study area. But still, I mean, it's been an issue because you have particular words, species name, for example, locations that are difficult to translate, and so that was an issue. And now that's going to be the same when we come the time to re-engage with the communities to share the results and to devise some, training material or campaign awareness material. So we're going to have to select people able not only to talk the language, but who understand also the culture behind,
Yes, yeah, for sure. Well, thank you so much for this great presentation and for the great discussion. Also, everyone, who has attended, and for a very informative session. I think there is. We have one more question in the chat.
That's a tricky one.
Yeah, do you see it? So up to now, there's no lab results available. Which bacteria, viruses on which species? I don't know if you want to, as a final question, maybe respond to this.
We do have results, and we could say, but we still have to finalize that, and we need to run some validation meeting with the authorities. So this is probably not information we can just leave in a meeting like this one. We're going to have to wait for having the go-ahead from local authorities before sharing the results or publishing.
Yes.
But we found stuff, and more than what we expected. Okay.
Well, I hope we'll all be kept updated on the progress of the project. So, well, thank you to all. And if you want to stay connected, or if you have any other questions, I think my colleague Masha, she already put the email of the Alliance in the chat, but also William's email. So feel free to reach out to us or to William directly. We'll share this recording and the slides as well in our members area. You can access this once you are registered as an Alliance member. So if you have not done so, you can also do that. I think there's also a link in the chat to do so. But yeah, feel free to reach out and to connect further.